Hello, this is our clinical correlation over prostate cancer and prostatitis by Haley, Hannah, Yolanda, and Gwen. The male reproductive system consists of a number of sex organs that play a role in the process of human reproduction. Most of these organs are located outside the body and others are located inside the body. The main function of the male reproductive system is to produce, maintain, and transport sperm and the protective fluid, semen. The external structures of the male reproductive system include the penis, scrotum, and the testicles. The internal organs, which are also called accessory organs, are the epididymis, vas deferens, ejaculatory duct, urethra, seminal vesicles, prostate glands, and the bulbourethral glands. The entire male reproductive system is dependent on hormones. The primary hormones involved are the follicle-stimulating hormone, the luteinizing hormone, and testosterone. The follicle-stimulating hormone is necessary for sperm production, spermatogenesis, and the luteinizing hormone stimulates the production of testosterone, which is also needed to make sperm. Testosterone is responsible for the development of male characteristics, including muscle mass and strength, fat distribution, bone mass, facial hair growth, voice change, and sex drive.
Prostate cancer is a cancer that occurs in the prostate gland. The main function of the prostate gland is to create semen and transport sperm, but in this particular case, the cell grows uncontrollably and develops into cancer. It is one of the most common types of cancer in men, but there are occasions where the cell will grow slowly and will not cause any trouble. There hasn't been a specific cause to prostate cancer, but we know that cancer develops when a cell is abnormal and begins to grow and multiply uncontrollably. The abnormal cell outlives the regular cell and accumulates multiple cells to form a tumor that takes over the area. There are no specific symptoms in the early stages that may be seen, but when it is more advanced, it can cause issues with the urination, including a slower stream, an appearance of blood in the semen, as well as pelvic area discomfort, pain in the bones, and some type of erectile dysfunction. There is a direct correlation with age. As you get older, men will have more of a risk to develop prostate cancer. Black men are at greater risk than other races, and the reason has not been determined for that yet. A family history of prostate or breast cancer increases the risk, and obesity makes treatment difficult to advance. Some of the complications of prostate cancer include metastation of cancer cells, and they may occur to leading cancer in several places of the body.
So looking at this prostate cancer diagram, we can see that it can range from the size of a peanut all the way up to the size of a walnut. So the cancer itself will form in the prostate, which is this little area here that's underneath the bladder. And depending upon its stages, it can grow to be very large and actually extend out of the prostate into various bones or structures in the body. Looking at the histological slides, we can see that prostate cancer has more nuclei than a normal prostate. Also, these pinky streams are tumor stroma, in which it holds all the tumor cells together in one area. When diagnosing the prostate cancer, scientists and doctors look at the PSA, which is a certain protein made by cells in the prostate gland that can be commonly found in the semen or blood. The different levels of the PSA prostate determine if one contains prostate cancer. The level between 4 to 10 means that a male has a 1 to 4 chance of actually having prostate, but if the level is over 10, that means that a male normally has a 50% chance of having prostate cancer. If a male is actually diagnosed to have a PSA level over 10, many will either have a digital rectal exam to see if they can actually see the cancer in the prostate, or a doctor will do rectal biopsies to take samples of the prostate to see if it has cancer cells in it. There are different stages of cancer. So stage 1 is whenever the cancer is probably about the size of a peanut or smaller, and we can do radiation therapy or sometimes just active surveillance, because many a times men who have prostate cancer, they don't need to have treatment because it doesn't affect their human body. Stages 2 and 3 normally result in radiation therapy or hormone therapy, or sometimes they can have a prostatectomy in which it actually removes parts of the prostate to get rid of the cancer. If it is stage 4 or higher, they will most likely need chemotherapy, hormone therapy, treatment for bone metastasis, in which the cancer has grown outside of the prostate into other organs or the bones, or they will need surgery to relieve certain symptoms of the body.
Prostatitis is defined as the inflammation and swelling of the prostate gland in the male reproductive system. This gland is located beneath the bladder, and its function is to produce semen, which aids in the transport and nourishment of sperm. There can be multiple causes of prostatitis, many of which go undiagnosed, yet the most common is a bacterial infection, either chronic or acute. This infection can take place when bacteria found in the urine leaks into the prostate from the urinary tract. There have been no proven studies showing that prostatitis causes prostate cancer or even increases your chances of developing it. However, one can be at risk for developing prostatitis if they recently had a bladder infection or had contracted a sexually transmitted disease. The symptoms of prostatitis include pain when urinating, cloudy or bloody urine, frequent or difficulty urinating, pain in the pelvic area, and possibly even flu-like symptoms in the case of bacterial prostatitis. When the prostate gland is inflamed, this causes the urethra to swell closed, causing the difficult or painful urination. These symptoms can come on suddenly and last a short while in the case of acute prostatitis, or occur gradually over time and can last for months or keep reoccurring if chronic. This problem is very common in men under 50, yet can occur at any age. Since prostatitis is defined as the inflammation of the prostate, it is very easy to see how inflamed and irritated the slide featuring prostatitis is compared to a normal image. It is not easy to see in this picture, but it can be expected to have a large presence of basophils due to their responsibility in our immune system for fighting off infection. When looking at a prostate secretion sample that is positive for prostatitis, there should be many white blood cells visible.
There are many diagnostic tests that a doctor may run when testing for prostatitis. Urinalysis is used to check for infection as well as blood test. Post-prostatic massage tests the secretions of the prostate. Imaging tests such as CT scans or sonograms can also be used when diagnosing prostatitis. In the picture above, where the pointer is located, this shows multiple ring-like calcifications. This can indicate chronic prostatitis. Depending on test results, the patient may be diagnosed with one of the following types of prostatitis. Acute bacterial prostatitis has severe symptoms, acute UTI, and systemic infection, which can affect the entire body. Chronic bacterial prostatitis can have symptoms of prostatitis, no symptoms at all, or even minor symptoms. Recurrent UTIs are also common with this type of prostatitis. No specific time frame is known, but patients generally have symptoms for more than 3 months. Chronic prostatitis, also known as chronic pelvic pain syndrome, has no UTI, so no infection, but the symptoms of a UTI. Symptoms include sexual dysfunction, pelvic pain, and difficulty urinating for more than 3 months. Asymptomatic inflammatory prostatitis, there are no symptoms, also no infection, and usually found by a doctor when testing for other disorders involving the urinary tract or the reproductive tract. This can lead to elevated white blood cells in the sperm, which lead to infertility, but is often left untreated in certain cases. The treatment for prostatitis can vary depending on the type of prostatitis that the patient has. The first and most common type of treatment is antibiotics, which would be used to treat acute bacterial prostatitis and chronic bacterial prostatitis. If the patient has very severe symptoms and is very much struggling with this, they can take intravenously antibiotics or orally. There's no cure for prostatitis, but usually they give the patient medications to help manage the symptoms. The first type of medication would be alpha blockers, which relax the muscle fibers and bladder neck where the prostate and the bladder join. This allows the patient to feel some relief during urination. Another type of treatment would be anti-inflammatory agents. This helps reduce inflammation and help combat minor pain experienced by the patient.
Our first exam question is, what treatments are used for stage 3 prostate cancer? The answers are external radiation, hormone therapy, or a prostatectomy. Our second question is, what are the different ways to screen for prostatitis? The answers are urinalysis, blood tests, post-prostatic massage, and imaging tests. Our last question is, what hormone is necessary for the production of testosterone? The answer is a luteinizing hormone.